Hello beautiful people, welcome back to my channel. I'm Teddy Blessings. If you're new, please subscribe and don't forget to hit the notification bell so you get alerted each time I upload a new video. Well, we're going to have a health talk, and today we're going to be talking about menstrual disorders, my ladies. So, with each menstrual cycle, the endometrium or the uterine lining prepares to nourish a fetus. If fertilization does not occur, then the body sheds the endometrium in each monthly cycle. Some women go through their monthly periods, with little or no concerns. They start and stop their monthly periods at almost the same time each month. However, some women experience physical and emotional symptoms severe enough to disrupt their daily activities, ranging from having heavy periods, missing their periods, to unmanageable mood swings which disrupt their day-to-day activities. Some normal menstrual periods may be long and others short, but the normal ranges from 5 to 7 days. But your normal may be different from someone else's normal. So what are these menstrual disorders? One, we have abnormal uterine bleeding. This includes menorrhagia, which is heavy bleeding, amenorrhea, no bleeding at all, and then having irregular menstrual periods, like bleeding in between your periods. Let's talk about menorrhagia. Menorrhagia is characterized by heavy and prolonged menstrual bleeding. It is severe in certain women that it disrupts their daily activities. The normal is between 6 to 8 times in each monthly cycle, in each menstrual cycle, but in some women who experience menorrhagia, they bleed 10 to 25 times more than the normal. You can imagine. Menorrhagia is common when you're teen and you're just starting your periods. You may experience heavy bleeding, and then when you're tending towards your menopause, like 50 years of age, you may also get heavy periods. What causes menorrhagia? One is hormonal imbalance. If your body produces these reproductive hormones, estrogen and progesterone, if it produces high or low, then you're more likely to get heavy bleeding in your periods, because it is these hormones that are supposed to regulate your menstrual periods. And then two, abnormal structures in the uterus. If you have fibroids, if you have polyps, if you have tumors in your uterus, then you're more likely to get heavy bleeding in your periods. Then there are medical conditions like thyroid disease. If you have liver disease, kidney disease, or if you have platelet disorders, like if you have a low platelet count. Platelets are the cells which help you in blood clotting. So if they are low, you're more likely to get heavy bleeding in your periods. And then some medications like blood thinners, like heparin. If your doctor prescribed for you a drug like heparin or clopidogrel and other blood thinners, you may get heavy periods you may get heavy bleeding during your menstrual periods. And then there are other gynecological conditions like infections. PID can cause heavy bleeding. If some birth control methods like IUD, intrauterine device, if you have it, then you're more likely to get heavy bleeding. And then some other abnormalities like an ectopic pregnancy. This is a pregnancy that occurs, that grows outside your uterus, and it is more common in the fallopian tubes. If you're having one, then you're most likely to get heavy periods. And then a miscarriage too can cause heavy bleeding, and it can be misinterpreted for a heavy period. So when you have menorrhagia, if you experience menorrhagia, you have to see a doctor to rule out what is causing the menorrhagia, because sometimes it may be a serious condition and it needs medical attention. How do you know that you have menorrhagia? If it requires you to change a sanitary towel or a tampon every hour, and when you change it, after that 1 hour, it is very soaked in blood to the extent of leaking, then know you have menorrhagia and you need to see a doctor to rule out the cause. The second menstrual disorder is amenorrhea. Amenorrhea is characterized by absence of menstrual periods for more than 3 monthly cycles. Absence of your periods before puberty is okay. Then absence of your menstrual periods during pregnancy is okay. Then absence of periods after menopause is okay. But if you don't fall in one of those 3 categories and you're not seeing your menstrual periods, then you need to see a doctor, because that is actually abnormal. There are 2 types of amenorrhea. There is primary amenorrhea and secondary amenorrhea. In primary amenorrhea, a girl child clocks 16 years of age and they don't see their periods. Actually, the menstrual periods can come as early as 13 years, rather as early as 10 years, and as late as 18 years. But if you clock 16 and they are absent, it is better to see a doctor to figure out whether they are just delayed or there is actually a problem. What causes primary amenorrhea? There may be a problem with your endocrine system. This is a system which deals with producing and stimulating and regulation of these hormones, or the hormones in the body, including the reproductive hormones, estrogen and progesterone. So if you have a problem, maybe parts of this system did not develop very well. It has the hypothalamus, pituitary glands, the ovaries, and other glands. If they didn't develop well, maybe it may be a birth defect. It may be a problem that came later. So if there is any problem, it may cause you to fail to get your menstrual periods at puberty. Then other causes may include low body weight due to eating disorders like anorexia nervosa, exercises. If you're having like very vigorous exercises which don't match with your eating, then you're likely to miss periods. Illnesses, stress, they can also make a girl child fail to get their periods at puberty. Then we also have secondary amenorrhea. This is diagnosed when you've been having your menstrual periods regularly, and then all of a sudden they stop for more than 3 months. This is caused by any problem that affects the levels of estrogen in your body, including stress, illness, ovarian cysts, a problem with your pituitary glands, exercises. We talked about exercises. And then if your ovaries were surgically removed, if you had an operation and your ovaries were removed, then you're not going to see your menstruation periods. The other menstrual disorder is dysmenorrhea. Dysmenorrhea is characterized by severe and frequent menstrual cramping and pain during your periods. Now, this menstrual cramping is due to uterine contractions triggered by prostaglandins. These are hormone-like substances produced by your uterine lining, and they are circulated in the whole body. So, the cause of dysmenorrhea is dependent on whether it is primary or secondary. In primary dysmenorrhea, the abnormal uterine contractions are due to chemical imbalance in your body. And then in secondary dysmenorrhea, the pain is actually due to another underlying medical condition like endometriosis, uterine fibroids, PID, tumors, and some other conditions in your uterus. There are also risk factors for dysmenorrhea. If you are a smoker and you smoke during your menstrual periods, this may risk you to get dysmenorrhea. And those people who also take alcohol in their menstrual periods, and then the obese people if you're overweight, and then if you also started your menstruation periods at an early age, like as early as 11 years, you're more likely to get dysmenorrhea. What are the signs and symptoms of dysmenorrhea? They include, we talked about menstrual cramping, which causes severe lower abdominal pain, and then low back pain, which sometimes radiates to your legs, headache, nausea and vomiting, lightheadedness, diarrhea, fatigue. All those are signs and symptoms of dysmenorrhea. The other menstrual disorder is premenstrual syndrome. You can call it PMS. This describes a variety of physical and psychological symptoms that women experience before and during their menstrual periods. These symptoms can be actually about 30 to 40% of the women experience these symptoms, and they are severe enough to disrupt their day-to-day activities. The symptoms appear 5 to 7 days before your menstrual periods, and they disappear as soon as or later on when you get your periods. These symptoms include, we talked about physical and emotional. The physical include bloating, painful and swollen breasts, clumsiness, fatigue, headache, constipation. And then the emotional symptoms include anger, confusion, lack of concentration, mood swings, anxiety and depression. Some people actually cry. Yes, for no reason they cry. So what causes PMS? PMS is caused by the rise and fall of these hormones, estrogen and progesterone, which may influence your brain chemicals, including serotonin, which is a substance that strongly affects your mood. It is not clear as to why some women get PMS and others don't, but researchers suspect that some women are actually more sensitive than others to changes in their hormones. The last menstrual disorder we're going to talk about is PMDD, and it is premenstrual dysphoric disorder. Actually, this is a worsened state of PMS, basically, like moving from a mild tension headache to a migraine, or heightened irritability, having very severe mood swings. So PMDD is more like a worsened state of PMS. So how are menstrual disorders diagnosed? You need to see a doctor. Actually, if you have one of the menstrual disorders that we mentioned, you need to see a doctor. The doctor will carry out a full physical examination and also carry out some investigations, and then they will be able to diagnose and confirm the actual cause of your disorder, especially for disorders like menorrhagia and amenorrhea. Then they will be able to give you appropriate treatment. The treatment will range from over-the-counter drugs to surgery. Remember, we talked about the causes of some of the disorders like amenorrhea and menorrhagia as being fibroids. If you have fibroids, you will never know you have them until you go to a doctor for them to check you and then be able to know that you have fibroids. And remember, the longer you stay with them, the larger they grow. So you need to see a doctor for any of your disorders, and then they'll be able to rule out what is causing the disorder, and then they will give you appropriate treatment. Now, there is no actual way that we can prevent some disorders like amenorrhea and menorrhagia, but once they develop, you'll be able to manage them. So how do you manage dysmenorrhea, like the painful, the cramping? Your doctor may advise you to get some over-the-counter medications like NSAIDs, and then exercise. You should include exercise as part of your treatment regimen. This will help actually with dysmenorrhea and PMS. Exercises increase your brain chemicals, which will give you energy and also improve your mood, and they also decrease on your anxiety and stress. Then if you get cramping, dysmenorrhea, you need to put heat on your lower abdomen. This will help lessen the pain. You can put a hot bottle of water or a hot towel. Then you also have to make some dietary changes. You have to cut back on alcohol, nicotine. That means you will have to stop smoking. Then cut back on sugars, salt, and caffeine, because these will worsen your symptoms. Then you also have to include calcium in your diet from sources such as low fat dairy products, soy products, green vegetables, and then you can also get calcium fortified orange juice. Then increase the amount of complex carbohydrates like whole grains, then fruits and vegetables. Then for PMDD, remember we said it is the worsening state of PMS. You have to see a doctor, then they will be able to prescribe for you like certain medications like antidepressants and others, antidiuretics. It will depend on what the doctor finds good for you. So that's all I had to talk about menstrual disorders today. I hope you've gained some knowledge. I hope it was helpful, and if you found it helpful, don't hesitate to like, don't hesitate to leave a comment, and also don't forget to subscribe. See you in my next video. Bye.